name is Casey Simpson, and I'm a student at Meridian Community College, and it's going to be my teaching project, and I'm going to be doing it on infection control. And I'm going to go ahead and give my quizzes beforehand, so that way you can answer it during, and we'll go over it after. My pages come apart. Okay. Alright. With infection control, the main thing is you have healthcare associated infections, which is formerly referred to as nosocomial infections. They are infections that are acquired as a result of exposure to a microorganism in a healthcare setting. Approximately 2 million hospital-acquired associated infections and 99,000 HAIs, or associated deaths, occur in the U.S. each year. And that's a lot. You have the antibiotic-resistant organisms can cause half of these infections. Up to 10% of hospitalized patients will acquire a healthcare-associated infection. Surgical and immunocompromised patients are the highest risk. Any organism can cause hospital-acquired infections, but certain bacteria, including E. coli and various types of streptococci, are the most common culprits. Approximately 1/3 of hospital-acquired infections are preventable. Healthcare providers often transmit healthcare-associated infections from patient to patient through direct contact. And we see doctors going all the time, they don't wash their hands, going from room to room. And we try to tell them, we get blessed out. Hand washing is or an alcohol-based sanitizer between patients and procedures and the appropriate use of protective equipment such as gloves remain the first line of defense to prevent the spread of hospital-acquired infections. Isolated infections can also be caused when bacteria that normally stay in one area of the body are introduced into another area. Therefore, care must be taken to change gloves and wash hands when moving from one task to another, even when working with the same patient. Like, you're not going to change their brief and then go to mouth care with the same pair of gloves. The Occupational Safety and Health Administration, OSHA, and the CDC recommended that precautions be followed to control the spread of disease, especially from antibiotic-resistant organisms. And that information can be found in your med-surg book on page 230. Okay, you also have a safety alert in your med-surg book, page 231. It says, do not rely on the presence of fever to indicate infection when older adults, because they have lower core body temps and decreased immune responses. If a patient is admitted with or develops an infection that is considered a risk to others, infection precautions may be needed. Who is the most vulnerable to hospital-acquired infections? Your premature babies and extremely ill children, your elderly people who may be frail, people with medical conditions such as diabetes, people with diseases that compromise their immune system, or people who are being treated with chemotherapy and steroids. Your risk factors for hospital-acquired infections are longer hospital or clinic stays. You have the type and duration of the operations and surgical procedures. Because usually, your laparoscopics heal quicker than your full-blown incisions. You have poor hygiene practices, overuse of antibiotics, wounds or infections, invasive procedures that require the use of equipment such as urinary catheters, IV drips, and infusions. High-risk areas such as intensive care units and high-dependency units. With your hand hygiene, you must wash your hands. It must be soap and water. Wash for 15 seconds with vigorous scrubbing to kill bacteria. You must wash your hands if you have a patient with C. diff. Hand gel Used for 15 seconds. A vigorous scrubbing, friction is what kills the bacteria. You make sure to scrub the back of the hands, fingernails, and thumbs. And best ways to fight infection, you can use a checklist, which is going to be wash your hands, wear PPE, reduce your workload, and follow your checklist. See, your most common hospital-acquired infections are pneumonia. It's an infection of the lungs that can cause mild or severe illness. Your symptoms can be a cough, shortness of breath, or fever. Tips to prevent it would be get yourself and your children vaccinated, practice good hand hygiene, do not smoke, keep your immune system strong by eating healthy, exercise, and getting sufficient sleep. Next, you have your surgical site infections. And incision and skin made by a surgeon to carry out surgery ranges from superficial to severe. You have symptoms as cough, shortness of breath, and fever. To help prevent it, ensure that the patient has showered and has removed jewelry before operation. Surgeons should decontaminate hands thoroughly and use sterile gowns and gloves. Cleanse wound regularly and correctly. Your wound care like called for. Then you have gastroenteritis, inflammation of the bowel caused by an infection. Your symptoms are diarrhea, vomiting, and stomach cramps. Tips for prevention: wash your hands. Do not eat raw or undercooked food like pork. Could give you worms. Wash your fruit and veggies thoroughly. Avoid contaminated water and ice cubes when traveling. Use bottled water whenever possible. One of your most common is going to be your urinary tract infections. An infection which occurs when germs enter the urethra and spread into the bladder. And your symptoms will be passing urine more frequently than usual, pain, passing urine, fever, and chills. Tips to prevent it: offer fluids and hydrate, wipe front to back after urinating and after bowel movements, avoid potentially irritating feminine products, catheter care, and early catheter removal. Then you have your bloodstream infections. It's an infection which can occur when germs enter your bloodstream. You can have, the symptoms can be fever, chills, general weakness, nausea, vomiting. And you can carry out thorough hand washing before operation. And cover the wound with sterile, transparent dressings to replace damp or soil dressings. Your steps for putting on your PPE, which would be first your gown, then your mask, then your goggles, then your gloves. And we have a thing here. And steps to take it off would be your gloves first, then your goggles, then your gown, mask, and then wash your hands. Then hand washing, because typhoid and Mary didn't have nothing else to do. Hospitalacquired. And let's see, it's the top 10 most fatal causes of death. This would be hospital-acquired infections. You are 3,333 times more likely to die from a hospital-acquired infection than you are in a plane crash. And 1.7 million patients acquire infections from hospitals each year. As a result, almost 6% die. And when you have nurses that are burnt out, 1/3 of all nurses experience burnout, causes 10% increase in hospital-acquired infection rates. Gloves, almost half are contaminated without ever touching a patient. Once they touch the door and whatnot. And there are more deaths per year with hospital-acquired infections than it is AIDS plus breast cancer plus auto accidents combined. Okay, and then you have your standard precautions and you have your transmission-based precautions. And that's your washing your hands, your PPEs, or your isolation. Okay, and ready to go over a test?
Yeah.
Okay, this is going to be true, false, and multiple choice. Your first question, standard precautions are the daily practices, example, hand washing, use of PPE, cleansing of equipment that will reduce transmission of infection. True or false?
True.
Okay. Gowns and gloves should not be worn in common areas such as nursing stations, eating areas, and elevators.
True.
Say the use of gloves is an effective substitute for hand washing.
False.
Right. Masks and goggles must be worn for care activities such as care of residents who have a cough.
True.
You must wash your hands after removing your gloves.
True.
The objective of these standard precautions is to prevent the spread of infection within the healthcare institution. Would be 1 from patient to patient, 2 patient to staff, 3 from staff to patient, and 4 from staff to staff, or 5 all the above.
All the above.
What infection control measures will help prevent disease transmission from the nursing staff to the patient? 1 gloves, 2 hand washing, 3 masks, or 4 all the above.
All the above.
Which of the following is the first priority in preventing infections when providing care for a client? 1, hand washing, 2, wearing gloves, 3, using a barrier between client's furniture and the nurse's bag, 4, wearing gloves and goggles.
Hand washing.
And let's see, bacteria and viruses can spread by way of 1, water, food, drinks, and eating utensils, 2, direct contact with people and or body surfaces, 3, coughing, sneezing, and vomiting, 4, equipment such as telephones, keyboards, computers, or 5, all the above.
All the above.
And alcohol-based hand gel should not be used, 1, prior to contact with patients, 2, if fingernails are chipped, 3, if patient has a respiratory infection, or 4, if hands are visibly dirty.
If hands are visibly dirty.
Any questions?
Nope.